It was supposed to be the trip of a lifetime, a voyage to the end of the world, Antarctica, the frozen south, the place most humans will never see. On April 1, 2026, the MV Hondius left the port of Ushuaia, Argentina. Ushuaia is the southernmost city on Earth. Passengers had paid thousands for this journey. They were adventurers, explorers. Retirees chasing one final grand dream. The ship was small by cruise standards. It held 196 passengers across 95 cabins. The crew numbered 72, around 150 people total were aboard, 23 nationalities, one shared excitement. Nobody was afraid, nobody had reason to be. The ocean was cold, the air was clean, the destination was breathtaking. And somewhere on that ship, a virus was already moving. It had no smell, no visible presence, no sound. It was already inside at least one person before the gangway lifted. That person did not know. Nobody knew. That is the nature of hantavirus, the pathogen now at the center of one of the most alarming outbreak stories of 2026. Hantavirus is not new. It is not exotic in the way people imagine. It lives in rodents, wild mice, rats, moles. Infected animals carry the virus their entire lives without showing symptoms. The virus replicates quietly inside them. It spills over into humans through contact with their droppings, urine, or saliva. You do not need to touch the animal. You only need to breathe near what it left behind. Think of it like invisible smoke. The rodent has already left the room, but what it exhaled is still in the air. The World Health Organization classifies hantavirus as a severe zoonotic disease. Zoonotic means it originates in animals and crosses into humans. According to the WHO, there are more than 50 known types of hantavirus worldwide. Most stay in their geographic regions. Most never reach the headlines, but one strain is different. One strain broke a rule that every other hantavirus follows. That strain is the Andes virus, and it is the strain confirmed aboard the MV Hondius. Before we go further, have you ever been on a cruise ship or a long voyage far from medical help? What would you have done if someone near you fell seriously ill at sea? Drop your answer in the comments. I genuinely want to know what you think. The Andes virus is the only known hantavirus that spreads between humans. Every other strain requires direct contact with rodents or their remnants. The Andes virus can pass from one infected person to another through close, prolonged contact. Researchers believe respiratory droplets play a role, being in the same cabin, caring for a sick partner, breathing the same confined air for days. On land, this is frightening. On a ship in the South Atlantic, thousands of miles from the nearest hospital, it is something else entirely. The question this story forces us to ask is not simply how did this happen? The real question is, how were we not more prepared for exactly this? To understand what happened on the MV Hondius, you have to understand where hantavirus has been before. The first documented outbreak that shocked the modern medical world happened in 1993. It occurred in the Four Corners region of the United States where Arizona, New Mexico, Utah, and Colorado meet. That spring, a cluster of young, healthy Navajo people began dying suddenly. They developed fever and muscle aches. Within days, their lungs filled with fluid. Doctors had never seen anything move so fast. The CDC, the United States Centers for Disease Control and Prevention, launched an emergency investigation. What they found was a previously unknown hantavirus strain. They named it Sinnambra virus. Sinnambra means without a name. It had been circulating in deer mice across the American Southwest for centuries. A surge in the rodent population that year, driven by heavy rainfall and abundant food, had pushed infected mice closer to human settlements. Of the initial cluster of cases, more than half died. The fatality rate for hantavirus pulmonary syndrome, the severe lung disease caused by New World hantaviruses, sits between 15 and 40% depending on the strain and how quickly treatment begins. There is no cure. There is no antiviral approved for hantavirus. Doctors can only support the body while it fights oxygen, fluids, mechanical ventilation if the lungs fail. The virus does what it does. Medicine watches and holds the line. Then came the Andes virus. In 1996, researchers in southern Argentina and Chile began documenting something deeply unusual. Patients were getting sick without any known rodent contact. Family members of infected patients were falling ill. Healthcare workers with no outdoor exposure were testing positive. A paper published in The Lancet in 1997 confirmed what scientists feared. The Andes virus was spreading human to human. It was the first and remains the only hantavirus ever documented to do this. Argentina's Institute, the country's national reference laboratory for infectious diseases, led much of the early research. Their findings were alarming. The Andes virus was not behaving like its cousins. It had found a new route, and that route went directly through us. If you want to stay ahead of stories like this one, the kind that matter before they reach the headlines, this channel covers them the moment they develop. Subscribing means you will not miss what comes next. No pressure, just an open invitation. In the decades that followed, outbreaks of the Andes virus remained largely confined to Patagonia. The region spans southern Argentina and Chile. It is remote, sparsely populated. The cases were tragic but contained. Argentina's health ministry recorded 28 hantavirus deaths in 2025 alone, up sharply from an average of 15 per year in the 5 years before. Something was shifting. Rodent populations were changing. Human activity in previously wild zones was increasing. Scientists at the Pan American Health Organization, known as PAHO, flagged the uptick. They noted expanding habitat overlap between infected rodents and human communities. The warning existed, it was documented, and then a Dutch traveler booked a cruise to Antarctica. History is not a warning, history is a pattern. And this pattern is still running. The index case, the term used for the first confirmed infected person in an outbreak, was a Dutch male. Index case refers to the patient who begins the chain of transmission. According to Argentina's health ministry, this man had spent 4 months traveling through Chile, Uruguay, and Argentina. He returned from Uruguay just 4 days before boarding the MV Hondius on April 1, 2026. Argentina's investigation, conducted by the Institute, traced his movements carefully. He had visited sites where Andes virus-carrying rodents are known to be present. He likely inhaled contaminated particles during outdoor activities. Birdwatching was specifically referenced in early WHO reports. He boarded the ship without symptoms. The incubation period for hantavirus, the time between exposure and the appearance of symptoms, ranges from 1 to 8 weeks. He was a time bomb no scanner could detect. By April 6th, he was sick, fever, muscle aches, fatigue, symptoms almost indistinguishable from influenza in the early stage. The ship's medical facility was small. It was designed for minor injuries and seasickness. It stocked anti-inflammatory drugs and oxygen tanks. It was not built for this. By April 11th, the Dutchman was dead. He was the first to go. His wife, who had been in constant close contact with him in their shared cabin, began showing symptoms. She disembarked at St. Helena, the remote South Atlantic island, on April 24th. She was airlifted to Johannesburg. She died in a hospital emergency department on April 26th. The Andes virus had crossed from one person to another in one of the most confined environments imaginable, a ship cabin. Shared air, a husband and wife, 2 lives gone in 15 days. A third passenger, a German woman, developed pneumonia on April 28th. Her symptoms progressed rapidly. She died on May 2nd. The WHO received formal notification of the cluster on that same day, May 2, 2026, from the United Kingdom's International Health Regulations focal point. Here, the International Health Regulations is the legal framework under which countries must notify the WHO of potential public health emergencies. By May 4th, the WHO had confirmed 7 cases, 2 laboratory confirmed, 5 suspected, 3 deaths, 1 critically ill patient. The ship was still at sea. It had stopped in Cape Verde, but local facilities could not safely manage an evacuation. Nobody left. 147 people remained aboard, including 1 body that could not yet be removed. Everything you are hearing is based on verified data from the World Health Organization, the United States Centers for Disease Control and Prevention, Argentina's Institute, and the UK Health Security Agency. This video is made for awareness and education. It is not a prediction that disaster will occur. Science deals in probabilities, not certainties. Our job here is to understand what the evidence actually says. The CDC classified the outbreak as a Level 3 emergency response. Level 3 is the agency's highest activation tier for a specific event. It means all available resources are directed at the problem. CDC epidemiologists flew to the Canary Islands. The WHO Director General personally traveled to Tenerife. The WHO shipped 2,500 diagnostic kits from Argentina to laboratories across 5 countries to expand testing capacity. A WHO expert was deployed directly onto the ship to assess every passenger and crew member individually. Spain's health minister described the planned evacuation procedures as unprecedented. No country had ever managed a hantavirus evacuation at sea before. There was no protocol. They were writing it in real time. The consequences of this outbreak rippled outward in layers. The immediate physical impact was brutal and fast. 3 people dead, a 4th critically ill in a Johannesburg ICU. A British passenger parachuted off the ship by military medical teams. British Army paratroopers literally dropped onto remote Tristan da Cunha, the most isolated inhabited island on Earth, to reach a suspected case there that had never happened before in any hantavirus response in history. But the immediate deaths were only the first layer. The second layer was the exposure network. 30 passengers had disembarked at St. Helena on April 24th, nearly 2 weeks after the first death. Before the outbreak was publicly known, those 30 people scattered. The UK Health Security Agency began contact tracing all of them across multiple countries. The Dutch Health Ministry confirmed that a flight attendant on a plane briefly boarded by the second victim in Johannesburg was showing symptoms and had been placed in isolation in Amsterdam. If that attendant tested positive, she would have been the first confirmed case with no direct connection to the ship. The chain would have grown a new link. The third layer was fear itself, and fear has economic consequences. The global cruise industry carries approximately 30 million passengers per year according to the Cruise Lines International Association. The MV Hondius story broke at the peak of spring booking season. Oceanwide Expeditions, the Dutch company that owns the Hondius, faced immediate reputational crisis. Expedition cruising, the niche sector that takes travelers to Antarctica, the Arctic, and remote islands, operates on trust. Passengers pay premium prices precisely because they believe operators have managed the risks. That trust had now been publicly shattered. broader than one company. The story raised a question the entire maritime industry had no clean answer for. What happens when a rare but lethal pathogen boards a ship weeks before anyone knows it is there? The critical window is now. Passengers have been repatriated to at least 14 countries. Each one carries a monitoring countdown. The incubation period means new cases could still emerge through late May 2026. The WHO has stated clearly that more cases may be reported. The pattern has not finished moving. The International Health Regulations Framework, the legal backbone of global outbreak response, performed its design function in this case. Countries notified the WHO. The WHO coordinated, resources moved, but cracks were visible. The ship's medical facility was inadequate for any serious infectious disease event. Expedition vessels routinely carry passengers to the most remote places on Earth, places hours or days from emergency care. The industry has no universal standard for onboard infectious disease capacity. There is no requirement for hantavirus diagnostic equipment on vessels sailing through South America. There is no mandatory pre-boarding screening for travelers returning from known endemic zones. The CDC guidance for hantavirus, last substantially updated before 2026, did not account for ship-based human-to-human transmission. Scenarios: the WHO's EAR framework is powerful on paper. In practice, it depends entirely on countries having the political will and physical infrastructure to act quickly. Cape Verde could not evacuate sick passengers because its facilities were insufficient. 3 days were lost at anchor while people remained aboard with a confirmed killer. What can an ordinary person take from this? First, understand that hantavirus risk in South America is real and documented. If you travel to Patagonia, southern Argentina, or Chile, especially for outdoor activities like hiking, camping, or wildlife watching, the CDC and WHO both publish specific guidance. Avoid rodent nesting areas. Never sweep or vacuum rodent droppings without a mask rated N95 or higher. Ventilate enclosed spaces before entering. These are not complex instructions. They require awareness, not specialized equipment. Second, if you are planning a remote expedition cruise to Antarctica, the Arctic, or any destination far from major medical infrastructure, ask your operator directly what their infectious disease protocol is. Ask what their onboard medical capacity covers. Ask what evacuation plan exists if a passenger develops a serious illness at sea. These are reasonable questions. Any responsible operator should have clear answers. Third, understand what the MV Hondius story actually represents at its largest scale. It is not a story about one ship. It is a story about what happens when wild ecosystems and human itineraries collide without adequate preparation. A man walked through a landscape where rodents carried a virus. He breathed contaminated air. He boarded a ship. A confined metal environment became an amplifier. The natural world did not invade the human world. We entered its territory. We brought the encounter back with us. Here is the question I will leave you with. If you were a passenger on the MV Hondius and you had noticed a fellow traveler getting seriously ill in week 2 of the voyage, would you have known what to do, who to tell, or what to watch for in yourself? Not the official answer. Your real answer. Write it in the comments. I want to read every single one. This is natural disaster. We cover what the earth, the sky, and the science are telling us before the rest of the world catches up.